There is something comforting about routine, about familiar tasks done the same way, in the same order, each day. These home routines are pretty much all that will remain, as 4 people from different corners of the country with different upbringings and opportunities and struggles are about to spend the next 7 years working toward a goal attained by very few people.
I wish I could have just said, relax. You're not the first person who's done this.
There are fewer than 3,700 neurosurgeons in the United States. That's 1 for every 61,000 people. Neurosurgery is one of the most prestigious, difficult, and stressful specialties in all of medicine.
I think anyone who's not intimidated is weird or strange.
It also has the longest program to train residents to become neurosurgeons, 7 years.
I don't know, 7 years is a long time.
These 4, Hunter Futch, Kwanzaa Warren, Vivek Sudhakar, and Megan Cosgrove, are overachievers. They have already completed college and med school, and now they have defied steep odds as there are far more applicants than positions and have been chosen to be the next class of residents at Emory University School of Medicine.
Trust your elders and listen to their advice.
They will work 80-hour weeks with 1 day off.
I think it really tests your limits and lets you know, like, where are my breaking points, and that's an important thing to know.
You can also see...
I would never do that.
There are a lot of things to consider.
They will learn from everyone around them because teaching and learning and making mistakes is done on the clock at an academic institution.
Try your best not to complain, because everyone who is in your shoes or ahead of you has gone through exactly what you're experiencing, and they know that it's hard.
This new chapter of their lives will often begin and end in darkness. The brightest lights, those of the hospital or the OR. In the days before they officially begin at the home of the chairman of neurosurgery, Dr. Daniel Barrow,
I want to welcome everybody here.
they get a glimpse of what it looks like to reach the 7-year summit.
After graduation, she initially followed in her mother's footsteps.
4 are graduating, now full-fledged neurosurgeons.
I do have some people I want to thank.
In front of mentors who help them learn the scientific and the technical and the artistic parts of their craft, they hearken back to the beginning.
We need to reframe that.
While the new quartet in the crowd hangs on every word.
I remember coming to this as an intern, just kind of like starry-eyed and not really sure, what to expect. And
Even for the head of neurosurgery, almost 40 years into his chosen vocation, gratitude remains for his mentor.
I want to welcome a very special guest.
The retired first chairman of the Department of Neurosurgery, Dr. George Tyndall, now 93 years old.
I owe everything that I've ever achieved in my career, whatever that might be, to George Tyndall. And so, George, thank you for being here with us.
I realized that there was a considerable potential in him.
60 years ago, when Dr. Tyndall was a new neurosurgeon, the field itself was still new, and good outcomes were often hard to come by.
I asked him one day, I said, whatever possessed you to go into the field of neurosurgery back in that era when there was so little that you could do for patients? And he responded immediately and said, because we knew it had to get better.
The neurosurgeons and the new residents at this party are tasked with continuing that pursuit of better, pioneered by the George Tyndalls of the neurosurgery world.
I miss the process.
I don't care if the patient owns the bridge, if they built the bridge, or if they live under the bridge. We treat them all with exactly the same respect.
Orientation.
What are some of our roles and responsibilities?
There are hours of presentations, introductions,
going to be your best friends and your worst enemies.
instructions.
Some of these patients are like he said, they're scared. They don't know what's going on. They'll nod their head like yes, but they don't really know.
A reminder it's okay not to know.
Don't feel like you have to have the answers, because you're not going to have the answers.
Slide your glasses off for them.
The 4 are fit with their surgical loops, which provide magnification during brain surgery.
Every neurosurgeon pretty much on the planet has a pair of these. This frame's gonna last your career. Perfect.
Oh, wow.
You like black, you like red. Look right here. I'm gonna rest this on the bridge of your nose.
And then an unexpected surprise.
Oh, awesome.
The delivery of their white coats.
Oh my gosh, I'm so excited.
These 4 won't be together for a while. Each will rotate, beginning to compile a necessarily massive amount of knowledge and experience.
Welcome to Emory. It's going to be a fast 7 years.
Hello, hello.
For new trainees,
And I think
every encounter is a learning experience, right? Every little thing, just how I relate to the patient. You know, what we're going to do is pretty straightforward. While we're here, I did want you to introduce you to Hunter.
Hunter is with neurosurgeon Dr. Aja Ndome.
I'm a neurosurgical oncologist, so I operate on brain tumors.
Dr. Ndome is removing a benign tumor from the brain of Tracy Anderson, a school teacher.
To the midline. There was a golf ball-sized lesion sitting right at the junction between the frontal lobe and the temporal lobe, which could become a problem. And all I expect, we'll detach it from the top, peel it off, get it out of there, put the bone back in place.
A tumor is why Hunter Futch decided he wanted to become a neurosurgeon.
When I was in middle school, I started having seizures, and so I had epilepsy for a couple of years. And then when I was 16, they figured out that I had a brain tumor. And so I had a medial right temporal lobectomy, which took out the brain tumor and the part of my brain that was causing me to have epilepsy. And for me, that was just a one-day surgical cure. And so after that, I was like, yeah, I woke up and I was like, yeah, I'm gonna do that.
When I say 2 hands, I meant, yeah, one hand
here?
stabilizing, yeah.
And it's graduated responsibility. You have to show me that you can safely cut the skin before you can drill a piece of bone. You have to show me you can drill a piece of bone before you can cut open the coverings of the brain. You have to show me that you can do that safely before you're going to get anywhere near a lesion in a patient's head.
There's brain, there's tumor.
The chief resident, Dr. Brian Buster, in his 7th year of residency, along with other residents, assist in the OR.
Okay. You use the belly of the blade, you're going to go to the bone, and you're not going to outrun the end of our fingers here, okay?
I mean, this is something that I literally have been thinking about for the last 10 years. Since I was 16 years old, I have been just working towards this moment, and that moment was, it was 3 days ago, and Dr. Dybert's like, all right, here's the scalpel, and for me, that was kind of a big moment. Sorry, you gotta give me a second. I'll be honest, I am over the moon about it.
My mom always said, Megan, stay in school, go to college. Both my parents didn't go to college, so I'm a first-generation college grad. And it's so funny because I always say that I took my mom's advice so seriously that I went to school from the age of 3 to 31. There was a lot of things that I considered, the work-life balance, what it's like to be a woman in neurosurgery, because there's not many of us, and whether or not I really wanted to go through with it. Every day I wake up and have to go to work this past week, and every day that I've ever had to go in to do neurosurgery in my rotations in medical school, they've been the happiest days of my life.
Megan's 12-hour ICU shift begins at 7 a.m. with updates on how the patients did overnight.
In the late evening, her ICP shot up and she started putting out bright red blood from her EVD.
She is 1 out of 5 in her right upper.
The neuro-ICU is a place where people with severe brain, spinal cord, nervous system issues come to get cared for. And you're trying to help people through the worst nightmare of their life and their families in a humane, effective, hopefully be able to offer a cure.
Let me ask Moni when she wants to round.
Neurologist Dr. Owen Samuels is the director of the Neuroscience Critical Care Program at Emory.
You need to dissolve some of this blood. How much?
Not sure.
Right, so you'd put in probably 1 milligram every 8 to 12 hours.
For the first several years, you just get your butt kicked. You're working all the time. You're on such a steep learning curve that every time you know something, you realize that there's a lot more to know. You want to just go in there for a minute?
Dr. Samuels has trained scores of residents and is fluent in all that can go wrong and right with the brain.
I was just devastated that he died.
Part of how this neurologist wound up spending his career in an ICU for brain issues is personal.
So my dad died at Yale New Haven Hospital, and I was shut out. And, and I could, I'd like to say now that I swore that if I had anything to do with it, I would never let it happen again to someone else. But that stuck with me. And I remember as a resident in neurology, just sitting outside, his room, just waiting, for the doctors to come by and being totally helpless and out of the loop and peripheral to his entire care. Good morning.
With the help of Georgia Tech environmental technology and architects, he redesigned the ICU so families could stay together.
I didn't know then that there was a sea of evidence that the design of the ICU would not only help families and patients have a better experience and do better, but also the nurses and the doctors would make less mistakes. And patients would need less pain medicine if you provided light. And if you lowered the sound burden, nursing would have, they would stick around longer, there would be less attrition, there would be less on-the-job problems. What do we need before you drill a hole in the head and pass a catheter?
Megan is going to perform an emergency bedside procedure for a patient with a brain hemorrhage.
And it is terrifying drilling a hole in somebody's head.
Yeah.
Megan was doing what all young new neurosurgeons do, is assessing a patient, understanding what's going on. In this case, it was a brain hemorrhage. The hemorrhage essentially bled into the fluid-filled cavities of the brain, obstructing their normal flow. And if you obstruct the normal flow, then your pressure in your head will go up and you can die.
There's hyperdensity shown, which is usually indicative of a new bleed.
Just use your words carefully. Someone's going to jump all over you if you say fresh blood, and they're going to spend 45 minutes questioning you on what the heck you mean by fresh blood.
Where do we want our, it's sort of like boot camp. You have to, get broken down a little bit and built back up. Let's go up on it, yeah.
Drew Albers, a third-year resident, has been working with Megan.
I vividly remember them, and I was about as terrified as you are, but you're doing awesome.
You want to be dead on to bone.
Dr. Samuels joins Drew and Megan as she puts in an external ventricular drain to relieve pressure in the patient's brain.
Okay.
After shaving a patch of hair and sterilizing the skin and making an incision, she drills the hole in the patient's skull.
All right. Ready?
Most importantly, remember, get perpendicular. You're gonna keep on drilling forward like this. Right? You're never gonna, when you get stuck, you're not gonna.
Oh yeah, of course.
And why aren't you gonna do that? Because the drill bit will leave the drill and stick in the skull.
Through the hole she has drilled, she places a catheter, which is like a flexible straw. She guides the catheter into the fluid-filled cavities in the middle of the brain.
But for now, just take your time. Line it up.
Stop right around 5.
Yep, stop. Stop. Pull your stylet. Good.
Now put the stylet down.
Yep.
Oh, there you go.
There you go. All right. Soft pass a little bit more.
Virtual high five.
Okay. Just got it all over. Thanks. Bye, guys.
It's an early victory, which is not the way it will always be over the next 7 years.
I'm really excited.
Intense?
Hopefully
stressful?
the next 100 go just as smoothly. I'm like sweating a little bit though. I need a shower, I think. It takes a lot of muscle to at least, maybe I need to go to the gym more, I don't know, but I didn't cross, right?
Didn't cross. There's your foramen.
The procedure worked.
Okay, that's where you want to be.
Okay.
It's draining well. She's getting benefit from it.
So I'm really excited. This is the best day for me.
Awesome.
I mean, he's got severe lower extremity weakness.
When most people think of neurosurgery, they think brain surgery. But a big part of the job is this.
Hey there. How you doing?
Seeing patients, assessing and advising people who are in pain, scared, and would rather not be seeing a neurosurgeon.
Through the years, it's just been injury after injury, you know.
Vivek is seeing patients in clinic with neurosurgeon Dr. Matt Gary, who specializes in spinal surgeries.
There's only so many patients that I can help by touching them, right? But there's so many more patients I can help by teaching the next generation of neurosurgeons.
His history is significant.
Hunter is with Dr. Barrow.
Alrighty, so where are his images?
Vivek and Hunter have daunting task: to glean all pertinent and important information from the patient and to fully relay it to Drs. Gary and Barrow.
And then just follow my finger with your eyes. Give me a bright light, okay?
Vivek debriefs Dr. Gary on a veterinarian living with chronic pain.
This is a 36-inch x-ray. You can see that he does have scoliosis. And does it radiate down his legs, or it's only in the back?
I forgot to ask that. I'm sorry. It'd be foolish to try and pretend that it's not going to be difficult, that there aren't going to be struggles, that there aren't going to be times where I'm going to get frustrated or upset. But you know, you really got to keep your eyes on the bigger picture, that even though today maybe it was a bad day, or today things didn't go exactly how you want, you really have to look at the big picture, look at what the training program is turning you into, look at the end of all of this, I'm going to be someone who is a neurosurgeon. I'm able to help people with these neurologic diseases get better.
Vivek knew before he graduated high school in San Francisco that he wanted to become a neurosurgeon.
So for him, it's going to be scoliosis.
Okay. You know, like a week ago, I didn't know how to put in orders or even like work the EMR, but now I like to think I'm at least like somewhat capable at doing that. Okay. So it's all about the smaller victories. I was the only resident in the OR, and they were looking to me like, what antibiotics do you want for this patient? I was looking over my shoulder like, oh, you're asking me.
You've been on treatment the whole time, but
Hunter sees Dr. Barrow's patients in a clinic a few miles away from Vivek.
now it was a completely homonymous right-sided hemianopsia, and now on my exam, it's really just the right quadrant, right lower.
There are things they get right.
Right, which you'd expect.
And things they will remember to do the next time.
Put kind of your diagnoses here.
Part of learning is also watching these experts care for patients.
I definitely want to take a look at some CAT scans to see what the bony anatomy looks like.
This is probably nothing, but even if it is a small aneurysm, it's in a very, very safe place. I'm glad we had good news for you. The artistic side is recognizing that we're treating human beings, and that's the side of medicine that involves the clinical decision making, which requires experience and requires knowledge and putting that all together to treat human beings as individuals, to be compassionate about their conditions, to be humble about what you're capable of doing, and to be able to guide them through something that, quite frankly, is very, very frightening for them.
But I really resisted it from a very early age.
Emily Barrow will tell you she didn't want to become a neurosurgeon like her father or an oral surgeon like her mother.
I saw the late nights. I saw them working all the time, being on call 24/7. They had to sacrifice, time with their family because the patient always came first.
The American Medical Association Journal of Ethics says 1 in 5 medical students has a parent who is a physician, 20%.
Non-functional tumor? Or?
Yeah, it was a non-functional tumor.
Emily joined that club despite resisting it as she grew up.
I'm a rhinologist and anterior skull-based surgeon.
Interestingly, she works with my colleagues and I. Neurosurgery and otolaryngology work together collaboratively on a lot of conditions.
And eventually went to med school, and I'm so happy that I did because now I love it. I mean, now it's everything.
This morning I'm going to be helping Dr. Hong with a tumor resection.
Kwanzaa Warren did her first year of residency at Columbia University, so unlike the other 3, she has 6, not 7 years left to go. She's working with the sole female neurosurgeon at Emory, Dr. Kimberly Huang.
I focus in primarily brain tumors and intraaxial brain tumors. Clinically, I really like minimally invasive techniques. I do awake brain surgery. I had a personal connection. My mom got breast cancer when I was in high school and just trying to figure out what I wanted to do. I knew I was probably going to be a surgeon because I like to build things, right, and to use my hands and to fix things in a very concrete way.
We heard that over and over from neurosurgeons, that they like to build things, that they're good with their hands, which is also why they love to operate.
That is my thing I love most, and that is purely based on adrenaline. I can be in the operating room for 5-6 hours, and it flies by in 10 minutes. We're doing a craniotomy to remove a benign brain tumor called a meningioma.
It's like at least 2 centimeters at least with your incision behind the tumor, because it's going to be 1 centimeter for the bone.
Over the course of half a day, the team successfully removes the tumor.
So when it bleeds, to help them see the source of the bleeding, you squirt some water on there without splashing in their face.
And just stay on the pedal while I'm doing it.
Kwanzaa is tasked with cleaning and attaching hardware to the piece of skull that will be put back on at the end of surgery.
That is not tumor, right? That's just brain. Training is very hard, long hours, and I think it may have been just a little intimidating when everybody else was sort of a male in the field if you were trying to be that first female. Surgery went well, as expected. And it is like a particular goal of mine to make sure that there's increased representation of women.
According to the American Board of Neurological Surgery, there are 219 female neurosurgeons in the country. They make up 5% of practicing neurosurgeons.
It's been well documented, sometimes we have imposter syndrome a little bit more than males do, or less confidence, and so I'm very aware of that. I mean, I feel it myself, so I have to make sure my trainees don't feel it, right?
When we were at home with Kwanzaa, she volunteered this.
There's a lot of imposter syndrome, I guess, that I have. I still feel like I'm talking about somebody else.
Of those 219 female neurosurgeons nationwide, only 33 are African American female neurosurgeons, 0.6%. Kwanzaa is the first African American female neurosurgery resident ever at Emory.
One of the reasons I went into medicine is because I have always been interested in a career in service. Both of my parents were in the military.
Kwanzaa's mother was one of 12 children who grew up in rural Alabama sharecropping.
She tells me some horror stories for sure. They did not treat them well, from what I understand, and they didn't have a lot.
Her father was homeless at times, raised by a single mom in New Jersey.
He basically joined the Army so that he wouldn't starve, because his mom kicked him out the day he graduated high school. I think my mom, she was teaching me to multiply before I started school. Like, she was like, you will do well. And I was like on the honor roll since kindergarten because of her.
Do you feel pressure for all African American women that you're forging this path? Do you feel like you're carrying that weight to a degree?
Absolutely.
Kwanzaa feels that anything people think of her, they will think of all African American women, and that it's not like that for the other residents.
You can just be yourself, and people will look at you and say, you have this personality trait, and that's just who you are, and that's fine. But I sort of feel like I can't have my own personality. I have to have the right personality so that you think as highly of me as you can, so I don't ruin anything for anybody else.
It's something most people cannot understand because they have never had to. Kwanzaa has a lot of support at Emory. She also has someone who has been there.
See that enhancement?
Dr. Ndome shared a story of a high-level class he did not drop at Stanford because he was the only black student in it.
There was no way I could give anybody the impression that the black kid couldn't hack it in the honors physics class. So I stuck it out because I knew that I had to represent. And I would finish my exam and I'd finish it quickly and I'd finish it confidently, and I needed everybody to see that.
Kwanzaa?
Kwanzaa's going to do amazing here. It's not because of me, but I'll certainly help.
Most of all, for the parents who fought and struggled to give their daughter a life they never had, Kwanzaa's success is also for them.
I feel like they deserve to have a neurosurgeon as a daughter because they worked so hard. way harder than I'll ever work. So, I mean, yeah.
The hard truth is you won't save everyone, no matter how hard you try.
Early in my career, there were occasional times when I would just go home and cry. And you know, those patients would walk across the foot of my bed at night, and it was difficult.
But the ones you save change your life too.
When you've seen people a year later come back to the ICU and say, my daughter, my son, my mother, my father told me that you guys saved my life. I mean, that's everything, right? I mean, it's a reason to live. It's not a job anymore. It's a mission.
And in between death and life is the rest of life.
Now you're colleagues with them. You're working across the table. You're doing a case together. You both have ownership at it.
Where residents unwind but still talk shop.
What did you guys think?
Where new residents do more listening than speaking. And where Thursday mornings at 6:30 a.m., it's school again.
Okay, so we closed the layer of nervous system tissue.
The whole department gathers for grand rounds, 2 hours a week for education.
In medicine, education's a lifelong commitment.
These four are at the beginning, part of a group for whom it will never end, for it's their purpose. How mysteries of the brain are slowly revealed. Each new thing learned could improve or save a life.
Welcome to the journey.
And that is worth everything.
Welcome to neurosurgery.